Today, I'm thrilled to share highlights from our very first live Health to Wealth seminar, which took place here in Fort Lauderdale, Florida. We're also announcing something exciting, the launch of our comprehensive home health care course. This event not only marked a milestone for us, but also opened up new avenues for entrepreneurs eager to get into the healthcare industry. If you're passionate about starting, growing, and eventually exiting a healthcare company, you're in the right place. At the end of the video, I'll be sharing how the home care course will be shaped and share with you the pre-registration details so you can get prepared and take advantage of our preferred pricing. My name is Carl Pierre, and welcome to Passive Workforce. Our Health to Wealth seminar was a resounding success, gathering inspiring entrepreneurs and industry veterans together in one room to discuss the intricacies of the healthcare market. We covered everything from regulatory hurdles to marketing strategies in medical staffing and home care. The event provided invaluable insights and networking opportunities, highlighting our company's commitment to empowering entrepreneurs. The way that the program was designed was that we were actually working off of each other. I myself focused mostly on medical staffing, and Sean was focusing on home care. And what we wanted to do was expose the audience to both sides of this staffing agency business and giving them an idea of what it looks like to run a dedicated staffing agency and what it looks like to run a home healthcare agency. And for those of you who don't know the difference, a medical staffing company is responsible for matchmaking between healthcare facilities and providers and the staff that want to work at those facilities. The difference with home healthcare is you're making that same sort of match, but you are the facility. As a home healthcare agency or as a home care agency, you are responsible for the lives of the patients and maintaining the regulatory compliance of a facility. Imagine a home healthcare agency being like a nursing home, except spread out over a city where you're managing people's lives one house at a time. And I felt that putting this together was going to be really useful because as someone who owns and operates both staffing agencies and home care agencies, I get asked a lot, what are the differences? How are they similar? How are they different? And that's what we covered in the seminar. We had a wide range of people in attendance. We had people from California, from the Midwest, from the East Coast, and of course down in Florida. And they were interested in so many different facets of the business. It was really entertaining and also really informative because we got to answer questions that were regional questions and questions that more than one person had. But one thing that really surprised me were how many people were interested in home care. And the key takeaway for me was that I need to do the same thing that I'm doing here for medical staffing companies for the home care agencies and put together a comprehensive program that will help people whether they're able to attend our seminars or they want to be educated from a distance. You see, during the seminar, it became evident that there was this growing interest in home care as a vital component of the healthcare sector. Participants were very interested in understanding how home care complements medical staffing. This enthusiasm really underscores the demand and potential profitability in providing comprehensive care solutions from the simplicity of companion care all the way through skilled nursing services. So for people who are getting a first look at the greater home care industry, you have to remember it's kind of broken out into 4 different parts. Companion care, which is like the most basic, then moves on to non-skilled home care, to then skilled home health care, and finally hospice care, which is really end-of-life care that takes place in the home. So people were asking questions because they kind of have it all jumbled in their minds. There was one particular guest who came to the seminar who's in the process of launching a skilled home care agency out in California. And one of the requirements for a skilled home care agency or skilled home healthcare agency that is looking to get licensed and credentialed by Medicare is that you need to have a certain number of patients under service. And that number of patients must be active at the time the surveyors come out to review your agency. And the question was, well, how do I afford starting this agency, providing services to clients, all while we don't have a payer in place? And we were going over strategies on really how to achieve that. And that got me thinking about when I launched my skilled home care agency down in Florida and having the same sort of issue. And obviously, since I've gone through it, I realized that there's better ways of handling it at a lower cost and or at a profit rather than the way that we approach it, which was to provide pro bono services. So seeing the sort of questions that were coming from the audience, it really made me think and realize I have so much knowledge in the home care space, why not really address those details, those nuances of the home care industry? Packaging it all up and presenting it in a way that will really help not only people get started, but really address this growing need that our seniors and the chronically ill in the country have for quality home care services. If you're enjoying this video, please do me a favor, like this video because it helps the YouTube algorithm, and also subscribe so that you don't miss out on when we put out more content like this. Whether you're interested in medical staffing or home health care, we cover it all in detail right here. Now back to the scheduled program. Encouraged by the feedback at our seminar, we are set to launch our home healthcare program, hopefully having it done by late summer to early fall. The program will comprehensively cover 3 critical parts of the industry: companion care, non-skilled home care, and skilled home health care. Each module is designed to equip you with the necessary skills and knowledge to succeed in these areas, ensuring that you can offer a spectrum of services to meet the diverse client needs. The way the program is going to be designed is going to be designed in kind of a progressive interest. A lot of people really start out on the companion care side of the business, mainly because it is loosely regulated or not regulated in many states and really doesn't require as much startup capital. So that tends to draw people in early. And in the companion care area, you're really dealing with private pay and hands-off care. But once you're in that line of business, you'll start to realize that that limitation of hands-off care kind of opens the door and raises the bar a bit for you to enter non-skilled home care, where you can actually touch the patient, bathe the patient, assist them with activities of daily living. So the program will be designed so that you can enroll into the level that you are interested in. So companion care first, non-skilled home care would be an add-on module, and then finally skilled home health care, which will cover skilled nursing, physical therapy, occupational therapy, all in the home care setting, and how you should go about the licensing for each, how you should be organized for each sort of company, and what are the differences. Not everybody's interested in skilled care, so you won't necessarily have to enroll for that module. But if you do enroll for the skilled care module, you're going to learn everything from companion care all the way through to skilled care. So depending on what you want and what's interesting to you and what you're really looking to address in the home care, the broader home care industry, we have it packaged for you. And we're pretty confident it's going to be one of the best programs that exists on the topic. Not only will we teach you how to go about this business, really the steps to get licensing and all of the paperwork that's involved, the policy and procedures, how to go about drafting those, but we plan on providing additional support such as group mentoring, one-on-one coaching, and if we find that there's even an interest the way that there is in the staffing side of the business, where we're doing full service setups, where we're doing your licensing for you, we're doing your policy and procedures, if there are enough of you who are interested in that, then we'll start to offer that service as well. This is exactly how we shaped things when we started Passive Workforce. We first rolled out a digital course which was comprehensive and taught you everything that you needed to know. And once we got feedback from you guys that you wanted even more help, even more support, we added that service on. And we'll be following the same sort of pattern here. But we'll also get you enrolled in our software, On Time ITS, and give you all the support that we possibly can so that you could go out there and land your first client. So if you're inspired to dive deeper into the world of home healthcare and you want to secure your spot in our upcoming course, pre-register now using the link that I've included below, or you can visit us at passiveworkforce.com for more information. This is your opportunity to turn your entrepreneurial aspirations into a successful healthcare company. Don't miss out on the early bird specials, as those are limited and I'm sure there's going to be high demand for it. Don't forget to subscribe to our channel for more updates just like this, and let's make your dreams of running a thriving healthcare business a reality. I'll see you in the next one.